Hi, my name is Dr. Brad Jacobs, and I'm here to talk to you today about back pain. Back pain affects millions of people and actually is one of the top leading causes for disability in the workplace. They estimate actually it's a $50 billion issue, which is massive. I myself have suffered from back pain for several decades, and I can tell you from firsthand experience what works and what hasn't worked. If you think about back pain, again, this is one of these areas that the mind is very involved in. The more stress we tend to have, we tend to locate it in our low back for those that are prone to low back problems. And you'll probably notice yourself tension in the lower back area when something alarming happens, or even if you're watching a scary movie, let alone a heated discussion. So one of the big issues to think about with respect to your back pain is noticing what's triggering your low back, what's triggering your tension in your body, and what sorts of things are causing sort of that alarmist response to happen. Another thing to think about is movement and posture. We spend so many hours of the day sitting in a chair at these times, working, sitting at a computer, hunched over, putting some strain on our neck and on our low back as a result of that. And so to be mindful of that, and thankfully there's a lot of different ergonomic applications and software that you can use. There's different chairs that you can purchase that will help you sit in a more comfortable and healthier posture. There's also balls that you can sit on that will actively engage your core and keep you engaged so that your core doesn't get relaxed and cause slumping, which then can lead to chronic back problems or acute back flares. In addition, there's posture support that you can insert behind your chair. So for example, if you have a chair, whether you're traveling on the airplane or you have a chair that you can't get that nicer version of to support your back, you can actually insert different supports on the back side of your chair. And there's a range of different products that would be helpful for that as well. Acupuncture has been shown to be quite effective as well in the treatment of acute low back pain versus chronic low back pain, not quite as effective. And then if you think about the range of different supplements and things that you can take by mouth or you can apply topically, I'm a big fan of topical ointments that you can apply to the low back that provide heat, penetrating heat into the low back area that will relax the muscles. In addition, some of these topical ointments have in them curcumin, Boswellia, or devil's claw, and these will act by different mechanisms, but will decrease. Some of them work by decreasing pain, such as devil's claw, like aspirin might work, and also if you think about curcumin as well, and Boswellia. Now those can also be taken by mouth or applied topically. In addition, if you tend to have prone to joint issues with inflammation, if you notice your SI joint, for example, is going out of whack, your sacroiliac joint, causing some inflammation, treatments such as a homeopathic topical called Tramil can be quite effective for that as well. So overall, think about what you can take by mouth and apply to your back, what you can do to engage your posture. When thinking about movement and exercise, to try and do daily, regular exercise, even if you're having back problems, to do a little bit every day has been shown to decrease back pain in the long term.